I think I'm going to get started just because we can introduce each other quickly. I think most of us know each other, but people will come rolling in as we do that. So I'm looking to hear any updates that you think are relevant to this group as we zip through, and I'm going to start with Chief McKern.
I knew you would pick on me right away. Tim McKern, Cool Scene Fire. Any other updates? We're doing lots of stuff. We got lots of, I'll say it for Dr. Carlbaum because he'll say it in a few minutes. CPR, 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 and more CPR, and Lucas Tools and harm reduction. And I actually walked over to the school and told them to stop putting so many dates on. We're actually going to be in the school probably 9 times in the next 2 weeks with the amount of information they're doing at the end. So with that, we're busy. And we like it that way.
All right. All kinds of stuff happening down there. Patrick.
Yeah, thank you and good afternoon, everyone. It's good to see all of you. We just completed a family-to-family class for individuals who have somebody in their lives who has a serious mental illness, and that went really well. The people who come are very, very brave, and we're glad that they're there, and that helps them. We also are looking forward to August when we're going to roll out a major harm reduction program. We're very excited about that. We're doing that in collaboration with the Accessible Community Advisory Committee, ACAC. We have a significant amount of funding from the state, and then now he's putting in some, and we're getting a little bit from the health department too. So we're very pleased about that. And oftentimes mental illness is not construed as a disability, but indeed it is. So we're happy to work with ACAC.
Thank you, Patrick. Commissioner Brotherton.
Thanks. Good to see everyone. I guess I'll go kind of CARES related, since I see that the grant agreement from this group is going to be on our consent agenda this coming Monday. So that's exciting to see that. And I also had the pleasure to spend a morning with Leanne and Jeff and kind of went out on the road with them and made a little video that's on the Jefferson County YouTube page. So check it out for a 3-minute talk about what they're doing. But it was definitely behavioral health. It's interesting. Seems like it really does fill a gap, and I'm glad we supported it ultimately. Yeah, just really excited about the program and want to share it a little bit. And anyone else, the real team, I'd love to take other ride-alongs and learn both in my capacity as a commissioner, and also I can help amplify it if there's something that you'd like to say.
Great, thank you. Sheriff.
I don't really have anything new to report, just going along with the program and taking care of law enforcement and helping out in the community where we can. So that's all I have.
Happy to have you out there. Dr. Berry?
Sure. So my name is Allison Berry. I'm your health officer. I am not always at these meetings, but I get an update from those of us who are. I'm here today, particularly because I know we're talking about kind of the nexus of public health and public safety, and so just to be available for that. Thankfully, COVID front does appear to be continuing to improve in our region, so we are seeing things getting better in that realm, and that is freeing up a little more bandwidth to engage a little bit more in some of those public health programs that we had to set aside for the last few years. So I'm glad to be here.
Thank you. Great to have you here. Dr. Carlbaum?
Hi, David Carlbaum, EMS Medical Director. I think a couple things at the Washington State Medical Program Directors meeting, where all 23 MPDs gather, had a nice discussion about data and about how to support local counties with data, and how we have a great system of data for trauma, but not for other exigent conditions like myocardial infarction and stroke and sepsis and et cetera, and how to streamline data to one platform. And I think the people that are doing an evaluation of the stroke and cardiac system in our state heard us. The other exciting news is that Adam Roving, who's an epidemiologist at the Washington State Department of Health, is developing an opioid overdose dashboard. It's in draft format right now, and it's going to be able to be drilled down to counties and timeframes and have some really, I think, good granular data that comes out of the Washington EMS record, WIMSIS, Washington EMS Information System. And the planned go live is August. I'm actually tentatively invited him in the meeting to our Behavioral Health Summit on July 19th, and he's very excited to present. I need to send him a follow-up email with details, but So maybe we'll get a sneak peek in July at this new way to assess impact of programs.
Well, that's exciting. Great. I'll look forward to that. Apple.
Hi, everybody. I'm Apple. I'm the director at Jefferson County Public Health. Just quickly, we have other staff from Public Health on the line today, so I'll let them share some things that are going on in their particular domains. I just wanted to update you all that the Behavioral Health Advisory Committee is currently working on reviewing RFPs for the school-based mental health so that funds can be applied for that. So that's in concert today, in fact, and through the rest of this week. Additionally, I wanted to let everybody know that we are hosting our first wildfire smoke community training next Tuesday on the 16th from 10 to noon downtown at the Cotton Building. And the reason I bring that up in this domain is that climate change and health impacts mental health and well-being. So we are working and queuing up more work through public health on climate change and health with things like community trainings. And lastly, I would just make a plug for Barb Jones, who's our CHIP program manager, who can't be here today, that she's continuing to work on many things, including the YAB, which if you don't know what that means, it's the Youth Age Band, which has, continued to be maintained through the pandemic and now currently and onward. One good fact about that is that she's queuing up a firearm safety event, which will be in September. We're going to do that down in Quilcene at the community center, and we're working hard to get endorsements and also set up a really accessible event for all kinds of people. More about that soon. We don't have any advertising. I just wanted to place that in your minds. We will be doing a little preemptive education about it at the All County Picnic, which is Sunday, August 20th. Thanks.
Great. Thank you, Apple. Chief Black.
Yeah, sorry, I wasn't quick on the button there. Yeah, we have, as usual, a lot going on. We're in the process of finalizing our applications for a couple of grants for CARES for 2024, but we're really excited to get the support from BHC and BHAC, if I got those right, to keep us rolling through 2023. I'd also like to say thank you to Apple and the commissioner for riding along with CARES. I think it's definitely evolved from its first couple of weeks, and I would invite anybody on this meeting that's interested in a ride along with CARES to get the full vision of what it was and what it's become. I think it would only strengthen the support. We are finding gaps, particularly I think over 80% of our contacts are over 65 years old in our community, where people are living their best lives independently as long as possible, but they could live better lives longer with some clear connections to resources. And that's really what CARES is. They're kind of like a concierge. So we're really excited and see how we can grow the program. If anybody has interest, please feel free to email me. Or if you have ideas on how to grow the program, one of the grants that we applied for could actually increase the capacity. And they're doing some amazing things with CARES in North Mason County. We're actually going to get a presentation here in a week or two from them on what the next iteration looks like. Yeah, really exciting time. And then as a reminder, kind of related to this group is EMS Week is coming up on May 21st. And East Jeff has started having a booth at the farmers market. And we're going to have a booth that Saturday, the 27th, and try to put together our forward-facing message for public as we deliver, EMS services through that mission and partner potentially with some other local agencies on our booth presence. So please stop by and see us.
Great. There's a lot going on there. Chief McCurran, did you have a question?
I'm going to tag on Chief Black. I'm going to publicly thank your crew. We actually made a huge difference in Quilcene, and thank you to Jeff and Leanne. They actually brought the entire process together. In other words, we got the navigator, we got public health, we got adult protective services, and now we have success in Quilcene on a gentleman that we were seeing every day for 14 days, and it works. The system works. So kudos to you. Congratulations on your letter of support from the Chiefs Association as well.
Yeah, thank you for the letter as well. And yeah, I think that success story is something that, Tim and myself and other firefighters have been dealing with our whole careers is,
Yeah.
We're trained to kind of do sets and reps of 911 response, but we don't really have the time or specialty that Jeff and Leanne bring. And I tell you, we could not hypothesize a better pairing with those two. It's amazing to see them do their work. So again, anybody that wants to ride along, call me up.
Thank you. Nat.
Hi, everybody. It's been a long time. I'm Nat Jacob. I previously was with Jefferson Associated Council, which is the local public defense operation here in Jefferson County in Port Townsend. And now I'm working for the State Office of Public Defense doing Blake work. Very interested in the conversation today. In particular, I noticed on the agenda there's going to be a discussion about the WASPIC letter that was recently written to the legislature regarding the special session that's going to happen just this next week to try and pass something out of the legislature regarding, we call it recriminalization, but also expanding access to public health, largely harm reduction services. And so I'm just curious to hear a little bit about what's going on with the WASPIC letter.
And we're going to have both. We've got some of everybody here at this table. We've got public safety, we've got public health, and then we've got the idea that we're all sitting at this table trying to meet those behavioral health consortium goals, which are to reduce overdoses and to increase recovery success.
Well, I'm just hoping we keep it in the 21st century when it comes to, data. So I'm looking forward to hearing more. Thanks.
Thank you. Anya.
Hi, everyone. I'm Anya Callahan. I'm the harm reduction coordinator with Jefferson County Public Health. One update, something that we've been talking about in the South County harm reduction group is these naloxone boxes. So like square metal or plastic outdoor boxes. And I just wanted to share that with the rest of the group in case people weren't aware of those. Just yesterday morning, Lori and I met with the board of Jefferson County Public Library at the library in Hadlock. And they were invited us there to talk about naloxone. And I shared with them these boxes, and they're interested in installing one there and doing trainings there and at the library. And then we're also, working with a Quilcene fire station to probably be one of the first locations to install one of the boxes, as well as potentially the community centers. So I wanted to share with the rest of the group and maybe share a list of potential places, and also say to people, if you're interested in having one of these emergency naloxone cases at your location or at your agency, to reach out to me so we can talk about that. I think that's my main update right now. Yeah, I've been attending an online summit this week on drug testing, which has been really interesting, and something I'm starting to learn a little bit about. Yeah, I'll pass it back to Lori.
Good stuff there. If you go to the meeting Padlet and go over under funding updates, there's the second paragraph or so down underneath that. There's a link so that you can see the outdoor box. It's an emergency naloxone box. And then you can also see the indoor box, and you can see a list of locations that we're brainstorming. We're not saying we're putting one up there because we know that there'll be people we need to engage and figure out how to best work with whoever is in charge of that space, and make sure that they want it there. But that will give you some background if you'd like to check it out. Denise.
Hi, I'm Denise Banker, and I'm the Community Health Division Director at Jefferson County Public Health. And it feels like all of the other folks from the health department have given updates that are sufficient to this meeting. Thanks so much.
All right, thank you, Denise. Knowing how many minutes we have. Lori Tinker.
Hi, I'm Lori Tinker with the EMS Council, and I plan on doing a lot more listening than talking during this meeting. Well, that's about it for me.
Okay, thank you for being here, Lori. Jim Novelli.
I'm Jim Novelli, CEO at Discovery Behavioral Healthcare. Just remind everybody, this is May, Mental Health Awareness Month, and we've had quite a few activities going on. You go to our Facebook page. We actually now have, I forget the other, I don't use half of them, but we have a Facebook page which we post lots of helpful hints on how to care for yourself. And So hopefully that'll be helpful. We were hoping to have a new website up and running this month, but it's still under construction. Things didn't move as fast, but we will be participating in the Roadie Parade, Pride event, even though that's after Mental Health Month, but trying to get the word out on mental health awareness. And of course, we do substance use also. That'll be coming up in Recovery Month when September rolls around. So, so.
Good stuff.
Yeah.
All right, thank you. Matt?
Hi, Matt Reddy, one of the Jefferson Healthcare Hospital Commissioners, and don't have any specific things to report on, but it's great to see everyone. Glad to be here.
Good to have you here. We missed you. Adam?
Hi, Adam York over at Jefferson Healthcare. I'm a data analyst. Trying to think of what would be fun to talk about here, but actually got one thing that we're working on that I was wanted to ask out to see if we have any weather experts around here, or if anyone here knows someone who collects historical weather data not too far back, like the last 10 years or less, it's fine. But we're kind of tracking kind of a little bit of a syndromic surveillance. I'm not like prepared to talk about the entire project, but I am interested in trying to get a solid set of monthly weather data, max temperatures, average temperatures, and things just for the county. I found some on my own, but I don't know much about weather, and it's hard for me to know if I have good data or not. So,
well, if anybody does have such a thing, Chief McCurry?
Yep, Adam, I'll talk to you offline. I got you covered.
Great.
I'll give you. You need a ROS station, and we have ROS stations around the Jefferson County. And what you're asking for is a link to a ROS station. And trust me, I can take care of you for those needs.
Awesome.
All right.
Thank you.
You bet.
That worked well. Rebecca.
Hi there, I'm Rebecca Marriott. I'm the Therapeutic Courts Coordinator for Jefferson County. I also don't have any specific updates, just glad to be here.
Happy to have you here. Colleen?
I got to remember what format we're to unmute. Hi, I'm Colleen Rodriguez. I am with the Jefferson County EMS Council, but I am also with Jefferson Healthcare, and I am the clinic manager for the behavioral health team. So thanks for letting me be here.
Thank you. Good to have you here. Nice to have some representation from the hospital. Brian Richardson.
Hey everyone, Brian with Dove House's Recovery Cafe, where we're creating peer support for recovery. Want to say thank you to Anya and Jefferson County Public Health for doing a naloxone training with us recently. And just to state for the record, we are unequivocally in support of naloxone distribution in our in box form, vending machine form, whatever, in favor.
Great. Thank you, Brian. Cassidy?
Hi, everyone. Cassidy Chang, Population Health Coordinator at Jefferson Healthcare. I also don't have anything specific to update on, but good to see you all.
Good to have you here. Lindsay.
Thanks, Lori, and hi, everyone. And I'm Lindsay. I coordinate the Community Prevention and Wellness Initiative in the Port Townsend School District, so general adolescent substance use prevention, and that funds the Empowered Teens Coalitions. And I believe, yeah, my co-conspirators here at Public Health definitely summarized everything that's going on in a really great way, and it's great to see you all today. Thanks.
Well, thank you everybody for coming today. One of the first items on our agenda is to talk about, I know there's a lot of discussion and exploration and research going on around the Blake decision and all of the positions that are being taken and written and explored. And it seemed like at this table, it was a great opportunity to kind of talk about two key factors that we have sitting at this table as we think about how best to meet the goal of reducing overdose and increasing recovery. So if you looked in your packet, and I'm going to trust you guys to look on your packet rather than sharing the screen. I sort of showed how we've got these three different things going on. We've got public safety, we've got public health, and we've got the BHC goals. And what we want to try to get to is the place in the middle where we're all working, however it is that we do whatever we do, we're working together on it. And I think in order to do that, we have to understand in the way that we say that we're going to meet, you know, people who are in their recovery, where they're at. I think we need to start by meeting each other where we're at on this issue. And to that, I've asked Sheriff Knoll to give us a bit of an overview of what he's learning and what he understands from the WASPIC letter. And then I'm going to invite other stakeholders to sort of bring their perspectives to the table. And our goal is not to solve it or to say that one is right or one is wrong, but at the end of the day, to figure out how are we going to take these disparate views if this table continues and work together to move forward. So this is the understanding building that we're doing between each other. And I'm going to start with Sheriff Knoll.
Okay, thanks. And thanks to everyone for coming. And I'm going to hog a minute of the time after hearing everybody talk about what they're doing. It did remind me of some things that we're doing here at the Sheriff's Office. And first of all, thanks to, I got to give thanks out to a couple people, but Jim Novelli from Discover Behavioral Health, at the end of the contract for our navigator this year, which I believe might be June, the Sheriff's Office and Discovery Behavioral Health are gonna pay for the navigator, so it won't be dependent on a grant anymore. So that's a good thing. The other thing I wanted to say at the drug take back, talking with Anya, she brought up the subject of what about giving out naloxone when people leave the jail. And I thought, well, that's a good idea. And we were gonna talk later and work on it. And when I came back to the office a couple days after that, I talked to Dave Fertino in the jail and asked if he's our jail superintendent, would there be any problem doing that? And apparently he was already getting us hooked up with the state. There's a grant that the state has. And so we're gonna be getting naloxone from them to be handing that out when people are released from jail. So I took a while for me to get back to Anya. I just did it today, but that was a really good thought. And if you don't think that's sufficient, let me know. And so anyway, there's a couple things we're doing. So
good work.
Thanks. So the WASPIC letter, I just realized that you had it actually posted there on the site. I don't know if everybody's had a chance to look at it. But I am the sheriff of Jefferson County, so I get to say what the law is going to be. And if you can mute Nat Jacobs right now, permanently mute him. Anyway, I have to say this letter was a surprise to me when I saw it go out. It seems to, in my opinion, and WASPIC is the Washington Association of Sheriffs and Police Chiefs. So most law enforcement chiefs and sheriffs are part of it, and there's hundreds of us. There's 39 sheriffs for the 39 counties, but there's way more police chiefs. So needless to say, Blake, or if you want to say I think of it as making drugs legal, has stirred up a hornet's nest. And and everyone's trying to work on what they think is the best way to make things better for everyone. So I thought that if it's okay, Lori, I was just going to kind of go through the things and just give it doesn't mean that I agree with these. And I don't know if everyone knows that, and maybe people do, but that King County had done a rebuttal to the WASPIC letter, which basically they don't agree with it. They agree with one thing on it, and that's the first thing here. The part of the new legislation, or the letter talks about the conference report on Senate Bill 5536. And I didn't know this, but in the new legislation, it talked about having a new law for public use of controlled substances, and both WASPIC and the King County letter don't think that's a good idea. And one of the main, it made me think about, well, there already is a law for that, but there really isn't, because I think the law was possession. So if you were using drugs somewhere, you would get arrested for possession. So one of the ideas being with that is it would be hard to enforce, because right now the way it would be set up is it would have to happen in an officer's presence. There's lots of laws that an officer has to observe before anything can be done. there's some laws that there's exceptions that an officer doesn't have to see it, so witness could say that something happened. So that's the first thing that the Blake talks about. And I should back up a little. And one thing that the WASPIC says is we respectfully request that legislature enact meaningful legislation to address the drug crisis in Washington. So you know, the idea of what's meaningful depends on who you're talking to. And some of the things that I thought were interesting for our group here too is the next one is modifying the drug paraphernalia provisions. And one thing that WASPIC is concerned with is that drug paraphernalia in the Blake legislation talks about it as being a public health supply, and that shouldn't be called that because you know, and especially a problem with the smoke, you know, distributing smoking equipment, that shouldn't be something that the local agency should be doing, and that it shouldn't be called a public health supply because it's really equipment to do drugs. So again, I'm not making any judgment on this. I'm just passing it on and I think it's, and I'm sure everybody here is pretty smart, and you know, it's good to know what the competing thoughts are out in the public. So now the next one's removing the provision that allows public health agencies to test drugs. So they would, you know, the idea that they would receive an illegal drug and then test it, then give it back. WASPIC doesn't think that should be happening. And then removing the state preemption on drug paraphernalia regulation. I had to actually look that up. And what that means is that right now, the way I understand it, there is no really no drug paraphernalia law in Washington State. So this I should say this letter too also has, you know, or the people, you know, there's been, you know, the Washington Association of Prosecuting Attorneys, correct me if I'm wrong, Nat, but that they were opposed to the legislation that was being presented. There's a lot of cities that were opposed. You know, there's people that are scared that their cities are going to turn into infested drug areas if this legislation isn't changed in some way. But so what some and that was even, I don't know if we talked about it here or not, but the idea that local jurisdictions could make up their own drug laws and paraphernalia laws, and depending on where you go would depend on whether something was illegal or not. So WASPIC is opposed to the legislatures saying no, drug paraphernalia is legal all over the state. And that's a broad, I'm oversimplifying, but so WASPIC would prefer that it gives some control over local jurisdictions to decide how they would want to address these issues. Am I taking too long?
No, we want to hear what you have to say.
Okay. One interesting one I thought was it's recognizing the separation of powers and granting diversions. And the way I understand that is that some of the legislation talks about the courts granting diversions, where really in reality it's the prosecutor who would grant the diversion. And Nat, I hope you can speak up if I'm wrong on that, but and I know from my being involved with mental health, behavioral health court, the prosecutor is basically the gatekeeper. I think that's the same for drug court, on who gets to get into there or not. So it's not that some other entity can say that happens, at least not the way that the Washington state laws are right now. The next one was requiring that SUD assessments be performed by a licensed behavioral health agencies. There's some concern that there could be some people that try to make money on this and aren't really certified by the state. And I will say that in the King County letter, it talked about that's a requirement already. So I don't know the specifics on that, but apparently there's some concern by WASPIC that they may not be state certified substance use disorder treatment people. Another one is that requiring the participant. So if you get arrested for, I'll just say a drug violation, and you get told that you're going to do treatment, so you won't go to jail, I suppose, that the legislation apparently talks about substantially complies with treatment as opposed to successfully completing treatment. And WASPIC believes that you should have to successfully complete your treatment before you're actually relieved of any fines or jail that you may have hanging over your head. Another one is that WASPIC would prefer that the prosecutor be able to terminate the pretrial diversion, which would be the treatment would be a pretrial diversion. So if the person is not completing according to the treatment provider, that the prosecutor could say, no, you're this is over. You need to go to jail now. One that I thought was weird, and I don't was that treatment providers would have to notify. This is what WASPIC would prefer, that treatment providers have to notify law enforcement if the person abandons treatment. And I don't understand why what we would do with that information. I could see the prosecutor or the courts or something being notified, but why we would have to know that, I don't know. And another one, which especially since I recently watched the Love in the Time of Fentanyl, which I keep thinking about, strike any reference to safe consumption sites from the legislation. Anyway, we strongly request that any reference to safe consumption sites be removed. So I'd just throw that out there for what it's worth. Harm reduction to be, they want harm reduction to be amended. While we recognize and support some interpretations of harm reduction, we adamantly oppose the interpretation that harm reduction includes helping people use drugs. And I'm trying to look for Anya on here. Maybe she had to leave. We talked about that at the drug take back, and because I was saying, it just seems, I feel like we need to, in my whatever, my knowledge and background and everything, it's like we should be trying to help people to stop using drugs. And sometimes I feel like harm reduction in a way is helping them use drugs. I think differently about that now, but I know there's a lot. Anyway, there's a lot of ideas and thoughts about that. So, but the WASPIC stance is that safe consumption sites be removed from any consideration. I guess that's how I read that. And then I was talking about the harm reduction. Yeah, that the idea that harm reduction must advance the goal of ending the illegal use of drugs. So a couple other ones, requiring sight and sound barriers at a recovery residence. The logic or the argument there is that you have people that are there at a like, if you want to say I don't know, trying to think of the name for them, but a house where people that are trying to not use drugs or getting treatment are housed there, and then some new people come in that have just been using drugs, and how bad that would be for the people that are there not using drugs, and that there needs to be some kind of barrier between the two, so that they couldn't have sight or sound of each other. I don't, in reading the King County response, their logic was, well, if the people are coming there, they can't use drugs. So just because they've been recently using drugs, is that really an impact on the people who have not been using drugs, and that maybe it can be beneficial for both to deal with each other. Same thing for juveniles. Juveniles being housed with adults WASPIC would want them to be have a sight and sound barrier between the two. I know that if you don't know, in the jail, we can't house juveniles in our jail. If for some reason we have an emergency reason that we have to put them somewhere out of sight and sound of the adults, and at the most minimum amount of time possible. And to me, I thought, well, that makes sense that you keep them apart. One thing that the King County letter brought up was by putting that requirement on a treatment facility or a safe house or whatever, is that it would it may be too big of a pain in the behind, so the kids might start get left out of any chance to go to somewhere like that. So one thing it talked about, and this is the last one, WASPIC wants to increase appropriation for arrest and jail or alternative programs. And I don't know that we necessarily have this here, but my understanding is it would be a place where if people were arrested, if you want to say, on I would hope a substance abuse crime, maybe something with mental health or something like that, and they really don't belong in jail. It's a place where you could take them to where they could be safe for whatever's going on. And apparently there's only 3 of them. The state provided funding for 3 of those facilities in the state, and the idea being that we need more, and it's not enough money. And King County basically agreed with that too. Anyway, that's all of that. I don't know if that's what people expected, but it's, again, I was it just seemed kind of, it seemed like WASPIC was, I don't want to say going with the flow, but the understanding. I thought, to me, there were some pretty specific things that maybe weren't worth the effort to fight against, and trying to reach a compromise. But there is going to be the Senate's or the legislature are going to meet on the 16th. I actually was at I don't think anyone had a chance. I got to go to a Scottish fiddle concert on Monday night and ran into Steve Theringer there, and I forget her name. I think her name's June. She's a senator from Snohomish County, who apparently is she's in the Senate, but one of the sponsors of the Blake bill. So they assured me that they're going to at least meet on the 16th. So anyway, I don't know if anyone has any questions for me, or if you want to do it that way, Lori.
I think what I'd like to do is have Dr. Berry sort of talk about it now from the public health perspective. We've heard a public safety perspective. Dr. Berry?
Thank you. And thank you, Sheriff Knoll, for summarizing the letter. I want to start by saying that one of the things I actually really like about my work here and in Clallam County is that we have such a collaborative relationship with EMS and law enforcement. And what was shocking, frankly, in this letter from WASPIC was that it seemed to basically target public health. And we ended up kind of directly in the crosshairs, which is not the kind of relationship I'm used to having with local law enforcement as we kind of work together to tackle this issue. And particularly, it seemed to take aim at evidence-based medicine generally. And so that was concerning from our end. I think that, speaking to my colleagues in Clallam and my colleagues here, there's valid concerns about what's gone on with Blake and concerns about crime. And there are places where I think we can all find common ground. This letter is not that place. And so the key things that I think are probably worth raising to just public awareness, particularly in groups like this where we work on this kind of important collaboration. So one is is the idea of actually just harm reduction generally. So particularly around paraphernalia, recriminalizing paraphernalia, which means, just to be clear on what we're talking about, we're talking syringes, and we're talking safer smoking supplies, we're talking fentanyl test strips, we're talking things that are becoming standard, and well, certainly syringes and fentanyl test strips are already standard in public health. And safer smoking supplies are already becoming standard in the work that we do. And the primary reason why we do those things is that we want to reduce the risk that you die while you're using, and we want to reduce the risk that you get hepatitis C, syphilis, or HIV, and then go on to give it to other people in the community. That's why we do those things. And the reason, I think a lot of people get hung up on the syringes, but a lot of people get hung up on safer smoking supplies because it's a newer idea that people are talking about. And so they might not make that connection. So the reason, the data that we have, and we actually do have data on safer smoking supplies, is that if you distribute safer smoking supplies, the people that you work with, the people who are currently using, are more likely to switch off of injecting and onto smoking, and are more likely to move into recovery. And we've actually seen that. So we already are doing a safer smoking program in Clallam County, and we've seen people move off of injecting fentanyl into their neck to smoking it to recovery. So it's a stepwise process to get people through this. And you don't go from just straight injecting fentanyl in your neck to recovery. You just don't. And so harm reduction programs are part of how we build those relationships with people, create a safe space where they feel respected, and where we reduce the risk that they get HIV and syphilis and hepatitis C and die in the meantime. You can't get to recovery if you're dead. And it doesn't make you more likely to get to recovery if you have Hep C or syphilis or HIV, I can tell you. So all we do in public health is try to keep you alive and try to keep you from getting infectious diseases. So all of my career, I've worked with people who are addicted to opiates. That's actually what I've been doing since the beginning of medical school back in Baltimore, because they got hit by the opiate crisis way before we did. And I can tell you, the thing that makes people use drugs is the drugs. It has nothing to do with the syringes. It has nothing to do with how they get them in. They will find a way to get drugs into themselves when they are addicted to drugs. It's the actual drugs that does it. It's not the method that they use. And Hep C and HIV is the lowest thing on their totem pole that they're worrying about. So if we don't take care of that, that's not going to get taken care of. The people who are using, they're worried about feeling better and getting their withdrawals gone, because withdrawals feel terrible and they will do anything to make that go away. And so the idea of making sure they don't get syphilis is real low on the things that they're worrying about. And so we take care of that for them. As we try to teach them about that, we try to teach them how to not get wounds. And there's actually a pretty massive evidence base on harm reduction that it not only doesn't increase use, but it actually decreases use. You're 4 times more likely to go into recovery if you engage with harm reduction services, which we at this table all want. You are much less likely to overdose if you engage in harm reduction services, and rates of infectious diseases drop in communities that have harm reduction services. And so I think the biggest thing that stood out to me in this position letter, I figured they'd want to recriminalize it. I just didn't expect they would go after these kind of basic evidence-based medicine techniques that we've been using since the 80s, at least when it comes to syringes. And so, thankfully, I think that's a bit of a non-starter at the legislature, but I wanted this group to know and have access to the data that we have access to when it comes to public health interventions. We feel quite confident that public health interventions are helping. The data all supports that, and that is not antithetical to a criminal justice response. Those can go together because, there still needs to be accountability for harms related to drug use. If there is violence, that's already illegal. If there's theft, that's already illegal. But people who are using deserve to not die in the meantime, and certainly our community benefits if we don't have spikes in infectious diseases in the meantime. And so that's what we do, is we try to keep you alive. And we know that our programs actually make you more likely to get sober down the road, which is going to help all of us and reduce use, reduce overdose, and reduce crime in the long run. That's kind of my response to that. Happy to take questions or responses.
I just wanted to say that, when I read that the position letter, first I thought, and it's not been the first time. I live in a different place than a lot of the other law enforcement people, But it usually seems to be in a certain geographic area, which wasn't on the west side of the mountains. But this, Waspic is the whole state, and I guess, it surprised me, especially when you're part of a group and you get, here's our position on blah blah blah. So anyway, and I am, I think you said, thankful that I work where I do and that we all collaborate together to, I'm not perfect on all I still coming around to some ideas, like pipes, but
yeah. Hey, we can get coffee and talk about pipes any day. I'll talk to you about it.
I know, but it's, and I think, and I don't want to speak for everyone, but it's kind of a big jump from what we, especially, I don't want to speak for cops all, but you kind of come from drugs are the bane of all evil, and then all of a sudden they're not, and that anyway, but we all know how
totally
it's a complex thing, and so I'll just be quiet now.
Totally.
I see Dr.
I quickly respond, and then I'll make space for Dr. Carlbaum, but I just that yeah, I think there is, and sometimes I also, in the harm reduction community, there are things that get said that I'm like, well, okay, I don't have to answer for that. Like I think we are of the same mind that it would be better if people didn't use drugs, and we want to move them towards not using drugs. And part of that is harm reduction, because that is what helps them get there. We're not saying like, everybody go out and shoot some heroin. That's not where we are. But this is just a way that we can help people get there.
Dr. Carlbaum?
Yeah, thank you. I'm sorry, I may have to leave to go do a procedure. I just want to say thanks, Sheriff Knoll and Dr. Berry. I think you are exemplifying what our community at a larger size needs to do, which is to talk. Because I think that's the challenge, is there's been a polarization and people, there's been a lot of science recently too about drug use, and it's a medical disease. It is a biochemical change. It's called chemical dependency for a reason. And I think everyone sort of has started to sadly gather a body of experience of friends or loved ones who have died or been impacted, or know someone who has a friend that's died. And that hurts. And we just want to say, just stop the drugs, everything will be fine. And unfortunately, I think the path forward is to sort of follow our best science that we know. It's going to be wrong in 10 or 20 years, right? Half of what we teach in medical school is wrong right now. We just don't know what half. But I think that's the path forward is about education. And I think that's where all of us, myself included, I'm learning a lot. But as someone who works in a hospital that receives most of the cardiac arrest from downtown Seattle, most of the patients I see, and last time I worked in the ICU 2 weeks ago, I had 3 people that died of fentanyl overdose from cardiac arrest. All 3 of those people, sorry, they weren't trying to use fentanyl, they're trying to use meth. One had been clean and his friends came over because he got an apartment for the first time in his life. A very nice black man who's 33 years old, got a job, got an apartment. His friends came over, someone said, hey, let's celebrate, use a little bit of meth, and he's dead. And so, and I think it's coming. And I think it's coming west. I think it's going to get worse. And so I think for me, I don't, anything that works to keep people alive, I think is what matters. And it's hard, and it's going to be hard. And there's many people in our community that it's harder for whatever reason. And yet I think the people that often don't have a voice are the people that it's the hardest for. And those are the people who are using, who are homeless because of their use, because of either systemic oppression or violence or racism or just bad situational decisions, right? I also learned a lot from Love in the Time of Fentanyl, and I just remember the one guy saying, there's nothing that separates you and me, just one bad choice. I had back surgery, I started oxycodone, and here I am. So thank you, sorry to be emotional about the secondary trauma I witnessed in the ICU, but it's getting really bad. So I hope we can all continue to educate each other and continue to move forward as a group.
And not to get any surgery. Are you saying that too? Don't get surgery.
Yeah, don't
Not
get back
unless you
surgery.
need it, man.
Yeah, don't get back surgery. Just go to the physical therapist, trust me.
Thank you.
Thank you. I know that we're at 3:50, but I wanted to give Chief Black a chance because he comes from the perspective of EMS and EJFR, and he's on site with law enforcement. So I thought his would be an interesting perspective to hear.
Yeah, thank you. You know, as we share with the sheriff, we're, you know, one of the two primary responders at 911 incidents that are on this topic. And, you know, so we're kind of the gateway into the system, so to speak. I think one of the observations I had the other night, I sat through a legislative summary from Van de Weeg and Chapman and Theringer. They were kind of giving us a summary of this topic. And one of the things that kind of struck me is a blind spot, or maybe just I'm not hearing it or we're not hearing it. But I think when we have legislation of this nature, we should always be skeptical of unintended consequences, not by anybody's fault, but just, you know, I think the one thing I was hoping to hear is some sort of analysis of if we're going to decriminalize, you know, some laws or this whole topic, what is going to be the impact to our world, the EMS 911 world, and how do we need to prepare for that impact, whether it's a surge or a reduction or a change in our call volume and the impact, you know, the responses that we get for this topic. I haven't heard yet anybody point to a study that would help us make just a more well-rounded decision, not necessarily, I'm not advocating for one side or the other, to be honest. I would like to know what's coming, to the doctor's point. Like, if it's coming, it would be great to see at least a little bit of a crystal ball of what we can expect, and then we can prepare. I've advocated several times over the past couple of years to have more overt training for our first responders, the gateway people for this topic, behavioral health, et cetera. When I took my EMT class, like so many of us in East Jeff, it was, you know, decades ago, and this topic was not in any of the curriculum. And luckily I've stumbled upon, you know, this group and others that have helped bring my awareness to a higher level. But I think we need to do a better job of training the initial responders for how to break that chain. I think I've actually stolen some of that wisdom from Jeff and Leanne, our great cares people as well, because they've made some referrals for substance abuse, alcohol abuse, et cetera. But I think seeing what study or analysis has been done, if any, to what we can expect if we're going to decriminalize, you know, the law bucket of tricks, you know, used to have, or, you know, after July 1 won't have the ability to offer people, you know, rehab and then expunge their records. It wouldn't have been decriminalized. Well, that goes away July 1. They don't have that option if they go and stick to rehab. So what is that? So that what used to happen is now not going to be optional. What can the fire EMS side expect, especially here in a rural community? Are we going to see it offset? Are we going to be expected to be that concierge to rehab? And we don't know anything about rehab. I mean, we'd love to, but we're firefighters.
Thank you. I appreciate that. We're at 3:54. I wanted to give Nat a chance to speak, but before I do that, I just want to tuck in here. This table, we're not sure if it's going to go forward after August. I would like to convene a subgroup of folks who are willing to look at that and figure out what the funding would be. There's a whole list of things that we would be talking about that's in your packet. I would like you to put your name in the chat if you would like me to reach out to you about that. If we don't have anybody that does that, I can't do that by myself. So if you're interested, you think this table is important, please let me know you'd like to be a part of that subgroup, and I'll make sure that we convene and have something by the time we come back to the next meeting. Okay, so everything else that you saw on our agenda, I think if you just look in the packet, and feel free to reach out to me if there's stuff you'd like to talk about more in depth. Nat, I wanted to give you a chance.
Well, be careful what you wish for.
Of course, you have 3 minutes. No.
Okay. Well,
My thoughts exactly.
Here's what I'll say. First of all, Joe and I are good friends, and I don't know if you have the same number still, Joe, but I called you ahead of time because I wanted to cut it up with you a little bit about this issue. I, like Dr. Berry, was also totally and completely floored by the WASPIC proposals, mainly not because of what's being proposed, although that floored me too, but the tone of it, there's not even really persuasive argument being made. It's just like, do this, do that. Certainly there's no data to support any of the arguments that are being made. And so that was really interesting to me. Particularly, I've been following, because of my new job, you know, the progress of 5536 as it made its way, and then ultimately kind of there's been a stumbling block in its passage. But that bill, as many of you around here know, the public health people in particular, contains a huge amount of expansion and funding for harm reduction programs, and has since day one, since the HRSA committee made those recommendations and they were incorporated into the original bill language. And I have seen zero pushback throughout the course of from WASPIC or anyone else, quite frankly, including mayors and other community groups, as to those things that are now suddenly in the crosshairs. And so I, like Dr. Berry, was completely and totally floored by those aspects, not so much the other things about diversion and what prosecutors should be able to do and this and that, but the public health stuff, because I've been really excited about the idea of expanding access to what we know works. And what, as Dr. Berry said, what we've known since the 1980s in some cases is actually effective, but that our drug war kind of approach, that kind of Scruff McGruff approach to you know, drug policy has kind of put the blinders over our eyes about those things. And so anyway, I'm wondering if Scruff McGruff maybe wrote the WASPIC letter to the legislature, if he's still around, but it certainly kind of has that tone. So I just wanted to say that because I wanted to give voice to that. I think sometimes our public health heroes, and that includes you, Dr. Karlbaum, and pretty much everyone around here, feel like they don't have a voice in these debates at this kind of, because everyone in the room is a lawyer, right? In these legislative sessions and stuff. And so I wanted to let you know that at least this lawyer hears you loud and clear and 100% respects and wants to lift up what you're doing in our community and beyond. And I'm even reading journal studies now, not that I really know how to read them, but you've got me inspired because your work is super important and it's saving lives. And that's really what this is all about at the end of the day. So that's just my 2 cents. And with the utmost respect to my friend Joe Knoll, and even Scruff McGruff, because he put out some good music in the 80s too, some good bangers. So, all right, take it easy, everyone. Thank you so much for including me.
Thank you. One last thing before everybody goes, I would like to log the thought with people that I think it would be something to discuss if we could start in our UAs, and maybe we already do in most places, testing for xylazine, because that is something that's being mixed in that we don't know to what degree it's here in our rural area. And so that's something I'll be reaching out to you individually to check. I'd like to see us do it in the talk screens with the coroner's office on potential overdose cases as well. Anything else before we?
I do have one thing. We do test for xylazine, but I just got a license to provide mental health counseling. So I was just going to share that with you, just so everybody knows.
Thank you. Thank you.
Yeah.
Congratulations.
Thanks.
And I'm sorry I didn't, I must, did I say?
I was late.
Okay.
It was me.
All right. Okay. I will be reaching out to you individually. Thank you for all of those folks who said that they would like to be on the sustainability subgroup. I'll be looking forward to talking to you. Everybody have a great afternoon. Thank you for being here.
Everyone.